great. Okay, Amanda, can you please go ahead and introduce yourself?
I'm Amanda Vaughn. This is my first year and I'm in speech and hearing.
Okay, great. So, Brittany, yeah.
My name is Brittany Campbell. This is my first year, and I'm in healthcare management.
Kara Gallamore.
Hi, I'm Kara, and I'm on the family nurse practitioner track, and I'm a first year.
Okay, great. Sybil.
Sorry, I was muted. I'm Sybil Prue. I am in USA's nurse practitioner dual role program. So I'm doing acute care and family nurse practitioner. And this is my first year and I'm really excited about it.
Okay, great. Erica.
Hey, I'm Erica. I'm a professional health sciences major with the healthcare management concentration, and this is my second year in the program.
Catherine.
My name is Catherine Lyons, and I'm a biomedical sciences major, pre-med, and this is my first year in the program.
Great. Gabby.
Hi, I'm Gabby. This is my second year in the program, and I'm a biomedical science major.
Ashley.
Hello, my name is Ashley Wynn. I'm a second year scholar and I'm in my third year in medical school here at South, and I'm pursuing a career in anesthesiology.
Okay, great. Catherine.
Yeah, I already went.
Oh, okay, you did? Okay. No. Okay, Shavana. Shavana, can you hear me? Okay, I will get back to her again. And Jakia.
Hi, my name is Jakaya. I'm a first year scholar. I'm studying speech.
She's having some.
Here in science at South Alabama.
Okay, great. Zakia, can you hear me clearly? Because you are having some issues when you are speaking. I think.
Yes, I can hear you. It's probably because I'm driving, so my service is probably going in and out.
Oh, okay. Nathan.
Hey, my name's Nathan. This is my second year, and I am a physician assistant student currently in my surgery rotation at South.
Great. Thank you all for introducing yourself. And now I am going to introduce our today's presenter, Natasha Yarwood. So Natasha, can you please go ahead and introduce yourself and tell them what you are doing with us?
Okay. Hi guys. My name is Natasha Yarwood. I just recently moved down here from New York City, and I'm a volunteer at Southern Alabama AHEC. I'm a psychology major in my last semester, and I want to go on to medical school to become a psychiatrist.
Okay, great. So thank you, Natasha. So today we gathered here to learn about some National Library of Medicine resources. So I will give the floor to Natasha to begin her presentation. Okay, so Natasha, are you ready to share your screen?
I'm ready.
Okay.
Let me see. Oh, it says you disabled screen sharing.
Okay, I enabled it right now.
All right.
Okay. So so Natasha will do most of the talking, and I will speak if I need it. Okay.
Okay, so today I'm just going to explain and show you guys how to use some of the resources available from the National Library of Medicine. And I'm sharing my screen right now, so I can't see any of you guys. So if you have any questions, you can just wait until the end of the presentation and I'll get to them, or just leave them in the chat. So you can see here some of the different resources we're going to cover: the Health Information and Career Awareness Program, the National Library of Medicine and Network of the National Library of Medicine, the NLM homepage, Medline Plus Espanol, PubMed, clinicaltrials.gov, Learning Resources Database, and the All of Us Research Project. Okay, so first I'm going to let you guys know what we've been accomplishing at Southern Alabama AHEC. We were awarded the All of Us Community Engagement Award by NLM, and with that award, we were able to create the Health Information and Career Awareness Program. So this project focuses on the public health priorities of our community and underserved populations. And the goals of this project are to improve the public's access to high quality health information resources, such as PubMed and Medline Plus, and help the public develop the skills to use these resources effectively. And another goal of the project is to increase the health literacy of the general public and to raise awareness and participation in the All of Us research program, which I'm going to talk about at the end of this presentation. So all of the resources I'm going to be talking about today are from NLM, and NLM is the world's largest biomedical library. Since its founding in 1836, it provides information resources on a wide range of topics searched billions of times each year from people all over the world. It also supports and conducts research, development, and training in biomedical informatics and health information technology. So I'm just going to go to the NLM homepage now. So here, this is an important thing. If you go to resources for you, you can click for healthcare professionals, and you can see a list here of helpful resources that you guys can use. A lot of these I'm going to talk about today. Okay, so the Network of the National Library of Medicine, or NNLM, improves public health by providing health professionals with equal access to biomedical information and provides the public with information that enables them to make informed decisions about their health. The program is coordinated by NLM and is carried out nationwide through a network of health science libraries and information centers. So these are just all the resources we're going to go over today and their links. And the first link here is a webinar that provides an overview of basically everything we're going to talk about today. It's 64 minutes. And so after this presentation, if you're still unsure about any of these or you're not sure how to use it, I would really recommend watching the webinar. It's super informative. Okay, so now I'm going to talk about the Medline Plus site. Medline Plus is a website that provides health information resources for patients and their families. It offers understandable information about diseases, conditions, and wellness issues. So Medline Plus offers trusted current health information in both English and Spanish, anytime, anywhere, on any device, completely for free. There's no advertising or endorsements, and it's accessible from your computer, tablet, or phone. And what really makes Medline Plus unique is it's the only resource that's really designed for public use. It's like a really accessible site, and everything is in easy to understand language. Okay, so now let's go to the Medline Plus site. Okay, so this is the homepage of Medline Plus. And if you look under the logo here, you'll see a bunch of different tabs. So the first tab here is the health topics. Here you can read about the wellness issues, symptoms, causes, treatments, and prevention of over 1,000 diseases, illnesses, and health conditions. So there are over 1,000 health topics in English and Spanish under these health topics here. And if you want to look for a specific health topic, you can either type here in the search bar, you can look A through Z here, or look under these 5 different groups: body system, body location systems, disorder conditions, demographic groups, diagnosis and therapy, and health and wellness. So for our example here, we're going to do diabetes. We can either type in diabetes here in the search, diabetes in the search bar here, go under A through Z, or go under disorders and conditions and click it here. So let's go under C here. Diabetes. Okay, so here we have our health topic here, diabetes, and each health topic includes 6 major focus areas: basics, learn more, see, play, learn, research, resources, and for you. And under basics here, we have a general summary of the health topic. Start here, diagnosis and test, and prevention and risk factors. They basically just have links to trustworthy sources where you can learn more about these things. So living with has information about living with a disease or condition and related issues, and genetics has topics related to the disease or condition, aspects of the disease or condition, and genetic aspects. So videos and tutorials just has videos and tutorials. Some other topics have like health tools such as interactive calculators and games or links to images. Statistics and research has data and the latest research from the NIH databases such as clinicaltrials.gov and PubMed. And the reference desk here has dictionaries or specific encyclopedias relating to the health topic. Find an Expert has links to organizations or specialty healthcare professionals. And then last, we have content for specific populations here. Say if you're a man, you wanted to look up information, or a woman. And then there's patient handouts. Okay, so the next tab here is drugs and supplements. And drugs and supplements is really useful because you can learn about your prescription drugs and over-the-counter medicines. And they tell you stuff such as the side effects, the usual dosage, precautions, and storage for each drug. And it has records of over 1,000 prescription and non-prescription drugs. And you can search this the same way as the other topics. Search in the search bar here, or go under, look alphabetically under this list. So let's see, we're gonna look up Tylenol. So we go scroll down. And so we see lots of Tylenols. Tylenol here and acetaminophen. So the good thing is it lists the brand name as well as the generic. So say you only know Tylenol or something, but you don't know the generic name. It lists them both together, so it's easier to find. So here you can see stuff it tells you, side effects, dosage, precautions. All right. Okay, and we also have herbs and supplements here, and this provides information on the effectiveness, dosage, and drug interactions for over 175 dietary supplements and herbal remedies. And this is super important because a lot of people take herbal supplements and prescription medications together, not knowing that there can be interactions and negative side effects, and they can even be dangerous. And like the drugs here, they're all listed alphabetically. So you can see here, I'll click one, and it says what it is, how effective it is, are there safety concerns, and if there's any interactions with the medications that you're taking. So, okay, so the next tab is genetics. And this is really useful. Everyone can use it, patients, students, healthcare professionals, everyone. It answers questions like what genetic mutations are associated with what condition, what is the pattern of inheritance for a specific disease, and how do we test for specific genetic disease. And you can explore here by genetic condition, a specific gene, chromosomes, and help me understand genetics is useful for patients trying to learn about a specific condition. It's an educational handbook that explores many topics about genetics in an easy to understand way. So we can look at how genes work. It basically just breaks it up into topics and explains it in simple language. Okay. So medical test has descriptions of more than 150 medical tests for the treatment of various health conditions. So we'll click a test here. So it says each description includes what the test is used for, why a healthcare provider might order the test, how the test is going to feel, how to prepare for the test, and most importantly, what do your results mean? So the videos and tool tab offers a variety of videos and tools, including surgery videos, interactive health calculators, and games. And say you're going to have surgery and you wanted to see what the surgery would look like. You could just type in your surgery here and you can watch a video on it. So say we wanted to watch a video on high blood pressure, we would type it in here. Now we're getting videos on hypertension and blood pressure. Okay, so back on the homepage, there's some other useful resources here. Like here's the Adam Medical Encyclopedia, and it has over 4,000 articles about diseases, tests, symptoms, injuries, and surgeries. And it also has an extensive library of medical images and videos. We're gonna go here to Healthy Recipes. Healthy Recipes has recipes that use a variety of fruits and vegetables, fat-free, low-fat, and have protein and healthy oils. There's a complete nutrition facts label included for each recipe. So we can see an example here. We'll go to breakfast and click peanut butter cereal bars. So you see it has the ingredients, directions, and the nutrition facts label here. And this is really good for patients who are struggling with their diet. You can recommend this as a resource for them. So now we have easy to read materials. This links to health information that's easier to read for people that are not in healthcare. It has like simple language. Organizations and directories link to directories of major health organizations. Health information in multiple languages provides materials in 44 different languages aside from Spanish. And if you want to learn more about Medline Plus, you can just go to Medline Plus, the site here, and go about Medline Plus. And you can read some more here. So another thing is the Medline Plus page is also available in Spanish. If you look here, there's an orange Espanol logo. You click it, it'll take you to the Spanish page. So you could also go to medlineplus.gov/Spanish and it would be the same thing. So this is the exact same as the English site, it's just in Spanish. And you can swap back and forth between the English and Spanish sites just by clicking the English here and the Espanol. Okay, so I think that's it regarding Medline Plus. So I'm gonna go to PubMed now.
Natasha.
Yes?
Before going to PubMed, can you please stop the screen sharing for a moment, please?
1 second.
Okay. So now there is a time for discussion. So can you please all unmute and open your video. Okay, so is there anyone heard about like Medline Plus, this website before? Is there anyone? No one?
I have used it before.
You heard? How?
In the nurse practitioner program, you have to write a lot of papers. You have wide-ranging topics, and it's just one of the things that you can use outside of just the biomedical library to find the information that you need.
Okay. Is there anyone? Nathan,
well.
did you ever heard about like Medline Plus before?
I have used Medline Plus.
Okay. So now tell me, what is the purpose of the Medline Plus? What is its purpose?
I think the purpose is to help providers and the lay public understand diagnoses as they're getting, diseases that they think they may have. But to use it as a consolidated point where they can look for information that's not just Dr. Google.
Okay.
I could be wrong.
Ashley?
I know in our med school program, we particularly like to use the videos. It's a good introduction prior to going to a surgery or chatting with our attendings about patients. We like to get a good brief overview. Also, we do send a lot of patients that we have to Medline Plus just to look up resources, recipes, particular things like that. It's just easy access and very simple to understand and navigate.
Okay, great. Good point. So, like how many of you think like health literacy is important? And do we have like enough health literacy to in our patients or our community members or our relatives, friends, whoever surrounding us? Do they have enough health literacy? Is the health literacy is important? What do you think?
I think it's very important. I think a lot of people in our communities don't have adequate health literacy because I don't think there's enough education out there regarding healthcare.
Mm-hmm.
And I think that this is a great resource for them.
Anyone else?
I agree that health literacy is extremely important and it's something that's really lacking in our community. That's why I think this resource is just so important because it's really easy to access. There's not really anything that's like this that you know has really good information, but it's also easy to understand for the general public.
Okay. So today we are here, you know, like because we want our community to learn more about the health literacy. See, like our parents, our friends, our relatives, sometimes they take drugs, but they don't know why they are taking, you know. So they go to doctor say that, okay, you have this disease, but they don't know much about that disease. Doctor prescribe tests, drugs, they don't know why they are doing the test, why they are taking the medication. You know, there are a lot of lack of information, not adequate health literacy. So do you feel we should do something about this so that we can increase their health literacy?
I think on from a perspective of medical professionals, I feel like we should have a bigger emphasis on patient education. I personally see a lot of very intelligent medical professionals, doctors, nurses, practitioners, whatever. They for sure are intelligent, they know what they're doing and they do great work, but they struggle putting medical diagnoses and indications, medications, things like that for patients in terms that they can understand. So yeah, patient education is important, but I think it's equally important that we practice and learn how to explain these very difficult things in a more common sense or simpler terms that patients can understand, and then also encourage them to go look up things and research on their own, because one is less likely to go to Medline Plus if they're like, okay, I have diabetes, but I don't know what that is, so who cares? They don't think it's important. So I think that's something we can do from our side to encourage and help improve that.
Okay, so thank you for sharing that. Let me give you an example to you how important the health literacy is, you know. So I'm telling from my life experience. So when I was a student of Western Kentucky University, that time I was working as a graduate assistant and as well as an intern with AHEC. So, you know, you all know that I am from Bangladesh, and people from Bangladesh usually basically eat fish and rice every day. You know, we have a lot of rivers. We just catch fish from the river, the fresh fish, and we cook, but we cook with bones. Okay. So here you can get fish without bones, but in Bangladesh, you can't get fish without bones. So we use like we cook fish with bones. So here in America, after coming here, like there was a long time I didn't eat fish with bones, you know, and we have a practice that once we put fish with bones in our mouth, we can like separate the bones easily, you know. It's a practice that you do from your childhood, you know. So it's not easy like to for us to eat fish with bones. So here we planned when I was a student, along with some of my friends, we planned to go for fishing. We caught some big fishes, we brought it at home, and like we cut it together. It was kind of a get together thing. So and we cooked it with bones, you know, and then we had our lunch on that day. So as I said, like for a long time I didn't eat fish with bones. So somehow one fish bone was stuck on my throat. Okay, so then I had a presentation on that day during the afternoon. So I went to the presentation. So it happened with me before, and it was not a big problem for me. So I just ignored it, and I went to the presentation. And in the presentation, as I had to speak a lot, so I was started to feeling pain on my throat. Okay, so I thought, okay, so I need to do something. So I tried to use my hand to pull it out, the fish bone, but I couldn't. So like what, like with time, pain was increasing because there was a big fish bone stuck on my throat. So then in that afternoon, I went to the AHEC director to speak about this with her and discuss like what should I do, because there is a fish bone stuck on my throat. Then she said, okay, you can try to go to the clinic on the campus. They may able to help you. So I went to the clinic, on campus clinic. So you know, they at first they didn't believe that there could be a fish bone can stuck on my throat. They didn't believe that. Okay, so somehow I was managed to convince one of the nurse there, and then she use a torch and a forceps to see is there actually she can see the fish bone. So she saw it, but she couldn't pull it out because it's like beyond her practice, you know. She can't do that. So then she said, okay, so you can go to the emergency service, in an emergency in a hospital, maybe they will be able to help you. Then around 9 o'clock at night, I went to the biggest hospital in Bowling Green, and I went to the emergency, and the doctor came. Like I did all the formalities, and then doctor came. He didn't like, I don't know what he was thinking. He suggested a X-ray, to do a X-ray and do some blood test. You know, there is no relation of doing the X-ray and having the blood test with the fish bone, you know. So he was like suggesting me to do that. Then I told him that, okay, so fish bone is a fibrous tissue, and how come you can see a fibrous tissue by X-ray? And he was mad on me. I said, do you know better than me? I said, like, I know that the fish bone is a fibrous tissue. You never can see a fibrous tissue in X-ray. So there is no point to doing an X-ray and expending money, you know, and you are giving me blood test. So why? What the purpose of this blood test? What do you want to see in this blood test? There was an argument, but finally, as when he said, like, do you understand better than me? Then I said, okay, let me pause for a moment. Let's see what he do. So he did the X-ray. He gave me the blood test. I was there until 4 o'clock in the morning, and then he diagnosed me as a sore throat and gave me ibuprofen and discharged me from the emergency. He never tried to look at and see like is there a, I had the complaint of starting fish bone on my throat. He never tried to see it, you know. He could use a torchlight and try to see it, and just it takes like a half minute to pull it out, the fish bone, if he can see it. He didn't do that. Then I was so mad on that night, on that morning. Then in the morning, I had a friend, like he is a dentist, so I went to him as a patient. Then once he heard that, and he said, okay, so do one thing, just remove your name as a patient, just visit me as a like friend. So I visit him as a friend, I remove my name as a patient. Then he used a forceps and pull it out, the fishbone. It took only half minute for him to pull it out by using a forceps. Okay. So so there was a fishbone stuck on my throat. And he gave, I said, okay, can you give me that? I want to keep it. I want to save it. So he gave me the fishbone. I took it and brought it at home. Okay. So after like 2 weeks, I got a bill from that hospital, like $2,500 bill, you know, for doing the x-ray and visiting the emergency. So now tell me, what should I do with that bill? If you are in that position, what do you do with that bill? Anyone? Unmute yourself.
I wouldn't pay for it. I would talk to the doctor and tell them that they made a mistake. They shouldn't have tested you like that.
Ashley, what should I do with that bill?
I think as an individual, like if I had no medical background and understanding, I would be upset and I wouldn't want to pay the bill. But from like a medical employee standpoint, I think one would argue like those tests were, it turned out not necessary, but it was necessary in the process. I don't know. I'm stuck in a bubble.
Okay, so the thing is, they didn't listen to the patient. The doctor did what he shouldn't do, because he never can find a fibrous tissue in X-ray. You know, I knew that. That's why I try to protect, you know, because I knew that fibrous tissue never can be seen in X-ray. But do you think like general people know that, will know that? No, they believe like whatever they are giving the test, sometimes they give unnecessary test. And like I'm telling in my country perspective, like in Bangladesh, doctors sometimes give tests that is totally unnecessary to only earn money. You know, sometimes they have like some kind of contact with different like diagnostic centers, and if any doctor prescribe tests, they get the percentage. You know, so there is a practice like this, unethical practice. So here in the emergency, the doctor gave me X-ray. So tell me why they gave me like blood test. What they want to see in blood test? Nothing can be seen in blood test, and they finally misdiagnosed as sore throat, like pharyngitis, you know, and they prescribe ibuprofen. How ibuprofen can help in these circumstances? Okay, so tell me, was it the ethical practice? Amanda, what do you think? Okay, someone is wanted to talk.
I don't think it was illegal. It was just unnecessary. I know that you can dispute it with your insurance company because like they charge you for like every single thing that they do in the emergency room. So that's probably why they did the blood testing. You know, you were saying you got a big bill and it came from blood testing and the x-rays and stuff like that. So you probably have it disputed with your insurance provider.
Okay, so now come to the point. So as a student, during that time, the insurance I had, that will not cover emergency visits. Okay, whatever you do in emergency, that will not cover. So that's come to a student, on a student's shoulder. So like, if you don't have that coverage, insurance can do nothing. Tell me. You know that you didn't get the service that you was needed, then you are paying that you shouldn't, then what are you gonna do? Tell me, anyone. How like we can take care? I could take care. Okay, anyways. So what I did, I went to the CEO of the hospital and explain anything what happened with me. Okay. And I said that if further I get this bill, I will sue, because I have this fishbone on my record. I saved it, and I have my friend who pulled it out from my throat, who helped me. And I discussed everything with my AHEC director during that time. So I told the CEO that if I get this bill further in future, I will sue. Then I never got this bill again. So I knew I had some kind of health literacy. I knew what's happening. I knew why they gave the test. I knew why they prescribed the ibuprofen. And I knew that that was wrong. So I was able to protect. But the general people, the community members that surrounds you, your friends, your family member, your parents can't protect. You know, even they can question the providers that why you are giving me this test. So do you feel like we should do something about this? We should educate our community members. Speak up.
I feel like it's our responsibility as healthcare providers to provide education to the community so that things like this happen less frequently.
Yes.
I feel like it's our responsibility.
Yeah, we should educate our patients. We should educate our community members. We should educate our relatives, you know, about health literacy. And this is the purpose of today's call. So
Well,
last year, hi Thomas, how are you?
I'm good. How you doing?
Good, good, good. Yeah, you wanted to say something?
Yeah, I just wanted to point out one thing. So as healthcare professionals, and just looking at the differences between professionals and patients, who gets sent to medical school for 4 years and then has to go through a residency? Who goes through all those programs to learn to do what they do and puts in the time and effort to do that? We do as professionals. So therefore, we have a responsibility to educate our patients, because they don't get sent to medical school. They don't get sent to PA school, nursing school, all these different programs. So they don't know. So it's our responsibility.
Great point. Great point. Thank you, Thomas. So yes, as a health professional, it's our responsibility to educate our community. And that's why we are here. There is a big gap between patients and the providers. Even there is a big gap between different health professionals like you all. You know, sometimes health professionals don't provide services as a team. That night, the nurses were there. She understood. Even she agreed with me that X-ray was unnecessary. But she didn't tell that night. I'm just telling you about that night. When the doctor prescribed the X-ray, suggested the X-ray, the nurses agreed that that's unnecessary. But she couldn't tell. She couldn't discuss with the doctor because there was a gap. So we have responsibility to bridge that gaps as a health professionals. Okay, so that's why we are here. And going forward, we will do a lot of presentation in the community to educate our community members about the health literacy. We will share the Medline Plus website with them. This is a good website and they can get their answer right away, whatever they need. You know, this is easy to read, easy to understand website, and everything, all information are authentic. That's most important. Sometimes we Google it and we find a lot of like website that's not provide like authentic information. You know, also they have the link how to evaluate your web search. They have the link in the PowerPoint presentation that Natasha is sharing. There are several links and websites that will teach you how you can evaluate a web search. you know. So Natasha can talk more about that. So let's give the floor to Natasha. Natasha, you can start your screen sharing again.
All right. Okay, now I'm just gonna give you guys a brief overview of what PubMed is and what kind of material you can find on it. And then I'm gonna show you how to use the site, just like I did for Medline Plus. So PubMed is a free online database from NLM. It has more than 30 million references to articles in biomedical literature with new material added daily. You can also find references to a small selection of online books and documents. So you can use PubMed to find a specific research article based on known information, such as finding the original research that prompted a news story, or you can find articles written by a particular author. You can also use PubMed to help familiarize yourself with a new topic. So PubMed is a database of citations, not full text articles, but PubMed offers references to PubMed Central, which is an archive with free access to full text biomedical journals. Okay, so the largest component of PubMed is Medline, NLM's premier bibliographic database, which has references and abstracts from more than 5,000 biomedical journals. Medline is a primary source for biomedical journal citations. It currently indexes articles in over 5,600 journals in 39 languages. So Medline journals are selected by the Literature Selection Technical Review Committee, a committee of expert advisors to NLM, and only around 20 to 25% of journals reviewed by this board are selected to be Medline. So these journals that are selected to be Medline are the best of the best. Okay, so now we're going to talk about medical subject headings, or MESH. So MESH is the NLM controlled vocabulary thesaurus used for indexing articles for PubMed. MESH allows you to quickly identify articles of interest, and they're arranged in a hierarchical manner called the MESH tree structures, which I've shown here. MESH terms are labels assigned to each article in Medline in order to describe what the article is about, 10 to 12 labels which best describe the content of the article. MESH terms also allow you to locate articles which are specifically about a topic rather than just mentioning it in passing. For example, searching for the word cancer would receive a ton of irrelevant results. However, a search for the MESH term neoplasms would only return articles marked specifically as being about cancer, thus saving your time. And I have a video here about how to use MESH terms, which I'm gonna show at the end. Okay, so now we're gonna go to the PubMed site. I have it here. Okay, so this is the homepage of PubMed. And the most important thing here is obviously the search box, but there's some other things you can look at on the homepage as well. Like under the Learn section here, you can click About PubMed to learn more about it. And the FAQ and User Guide section can help you learn more how to use the site. So I'm going to show you guys the most common tasks people use PubMed for. So first we're going to search by a topic. So when you're searching by a topic, you want to be really specific and don't use any punctuation. So I'm going to type in something like acid reflux. And this is going to give me terms and articles about acid reflux. And by default, the best matches for your search are on the top here. So we can click on something here, article here. So here's the abstract page, and this shows a lot more information than just the summary that was on the previous page before. So we have our basic citation information here, including the journal, issue, and page number that it's from, title, authors, etc. Okay, so another thing you can do is search by author, and the most effective way to search for an author is to search the author by typing in their last name and initials. And like the previous search, you don't want to use any punctuation. So for example here, we're going to search for Fiona Melanie Wood. So we're going to type in the search bar here, Wood, FM, no punctuation. Okay, so here we can see articles by authors with the last name Wood and the initials FM. Okay, so to find a known article, you can use the citation elements like the author name, article title, or the journal name. So we're going to look for an article written by Martin Nolte in the journal Blood, published in 2020. So like the previous searches, we're going to use no punctuation. So we're going to type in Nolte, Blood, 2020. So here we see PubMed has located the article here. So if say there was multiple articles down here, then you would see the additional results underneath. Okay, now we're gonna search by journal. So if you wanna search by journal, you can search by the complete journal name or the International Standards serial number or the Medline journal title abbreviation. But if you wanna search by journal name, make sure you type in the full journal. You can't use a partial journal name or it's not gonna work. So we're gonna try to look for the Journal of Pediatric Surgery. So I'll type in the Journal of Pediatric Surgery. Okay, so here are my results, and this is all of the citations in PubMed from the Journal of Pediatric Surgery. You can search by best match or most recent to find your results. And if your journal title is also like a subject name, like just cell, cancer, or pediatrics, or if you don't know what the exact journal name is, you're gonna have to use the advanced search function. So for that, we're gonna click advanced under the search bar here. We're gonna go down and click journal. And then we're gonna type in some characters from the journal name. So let's do pediatric. Okay, so we have the Journal of Pediatric Surgery. Click add, and then search. So then here it gives us our results right here. Okay, and if you want to find citations that are linked to the full text, you're going to just run your search. We have our search here. And then on the left-hand side, you'll see these filters right here. So if you click full text, then you'll only get citations that have links to the full text articles. You could also click free full text, which will give you links to citations that only have free full text articles. So you can also filter your searches by other things as well. You can filter by species, language, sex, subject, journal, and age. So here you go, right here. And let's say we wanted to click the full text here. We'll click this. And here you'll see where the full text links are available. So you just click on this and you'll get access to the full text. Okay, so now we're gonna watch the video on how to search with the mesh terms.
Video demonstrates how to use the MESH, or Medical Subject Headings database, to create a targeted PubMed search. From the PubMed homepage, in the More Resources section, I'll click the link to the MESH database. MESH is the controlled vocabulary used for indexing PubMed citations. Let's say I want to find articles about problems associated with giving flu vaccines to individuals with egg allergies. I'll first search for flu vaccine, which returns the mesh term influenza vaccines. The page displays a definition and additional information about the term. In the mesh database, terms are arranged hierarchically by subject categories, with more specific terms arranged beneath broader terms. You'll notice that influenza vaccines is listed under viral vaccines, which is under vaccines. I'll click vaccines to display the variety of terms available under this concept. Let me take a two-sentence aside here to mention how mesh terms help your searches. During the indexing process, the most specific mesh terms are applied to a journal article. Then during your PubMed search, mesh terms recognized in the query are automatically mapped to the most specific terms, and those are included in your search. Okay, I'll click back to influenza vaccines and continue with my search. These subheadings may be used to narrow the search. Since I'm interested in the negative effects of the flu vaccine, I'll click the subheading Adverse Effects, and then click the button Add to Search Builder. I want to further limit to articles on egg allergies, so I'll search mesh as I did with flu vaccines to find the appropriate mesh term. I'll enter egg allergy in the search box at the top of the page. The database displays the mesh term egg hypersensitivity, which I'll add to my PubMed search by clicking the Add to Search Builder button. I'm now ready to search PubMed, so I'll click Search PubMed. This search retrieves a relatively small number of targeted citations. You'll notice that all of these citations are tagged with the text PubMed indexed for Medline. This indicates that the citation has been indexed with mesh terms, but please keep in mind that not all PubMed citations are slated to be mesh indexed, and it may take several weeks for a new citation to be indexed. So using mesh terms will limit your results to a subset of PubMed citations. To see all the mesh terms used to index an article, click on an article title, and then click on the mesh terms label. Each mesh term includes a menu that can be used to search the term in PubMed or mesh. Back on the mesh homepage, you can read more about using mesh by following the help link, and send questions by using the link right to the help desk.
So I hope that helped you guys with the mesh terms. Okay, so these are just some tutorials and recordings that will help you guys use PubMed. There are classes you can take and handouts. And the last link offers some webinars showing you how to use PubMed. And there's also the trainer's toolkit, which provides instructional materials that can help you teach other people how to use PubMed. And here, quick tours here. All of these are videos that basically just went over what I talked about, how to find articles on a topic, by author, from a citation, by a journal. They're just short little videos. I embedded them into the presentation, but you could also go here and watch them as well.
Okay, thank you.
Okay, so that pretty much covers PubMed. Now I'm going to talk about clinicaltrials.gov. So clinicaltrials.gov is an online resource that provides healthcare professionals, researchers, and the public with easy access to information on clinical studies on a wide range of diseases and conditions. So clinicaltrials.gov contains information about medical studies in human volunteers, and most of the records describe clinical trials. And a clinical trial is a research study where people volunteer to test new ways to treat or manage a disease or condition. People are assigned to one or more interventions, for example, a medical product, behavior, procedure, which may include a placebo or other kind of control. So researchers can evaluate the effects of the interventions on the volunteer's health or behavior. So as a healthcare provider, you can use this database to stay up to date on developments in your field. And for patients, they can search for recruiting trials that they can participate in, or they can learn about new treatments that are being studied. So let's go to the site. Okay, So we're going to look for trials that are recruiting to study a specific condition. So we're going to click recruiting and not yet recruiting studies, and then type in a condition or disease here. We'll do breast cancer and click search. Okay, so I used breast cancer and I got almost 2,500 results. So you can click on any of these studies to learn more about them. I'll click on this one right here. So all of these records present summary information about a study protocol, and they include the following: which disease or condition is being studied, the intervention, the title of the study, description and design, eligibility criteria, the location where the study is being conducted, contact information for the study, and then links to relevant information on other websites such as Medline Plus and PubMed. You can see the mesh terms here. Okay. So we're going to move on to the Learning Resources database. So we discussed a lot of information so far, and I know it can be really hard to remember all of this. Well, that's where this Learning Resources database really comes in handy. Like, this site is really useful. It has educational resources like videos, tutorials, and handouts for all of the NLM resources we just went over. So say you can't remember how to use PubMed. You would go on the Learning Resources database here. You can type in PubMed and search. So here you can see a lot of different tutorials and tips on how to use PubMed. PubMed, how to find articles by journals, tips for using PubMed, and what's in PubMed. So if you want to learn about any of the resources we just talked about, this would be a really good place to look. It has all of the NLM resources, and you can get a lot more information than what I can just show on a short PowerPoint. Okay, so here's some other resources that you guys might find useful. The Drug Information Portal is basically the same thing as drugs and supplements on Medline Plus. You can search for prescription and non-prescription drugs and supplements, but the cool thing here is you can search by name, but you can also search by class. So say I wanted to look up antidepressants. I can look up atypical antidepressants. And then it gives me a list of all of the drugs that would be in this class. So Public Health Partners gives us access to selected public health resources on the internet. And you can find literature and guidelines relevant to public health, legislation, conferences and meetings, people working in public health. You can also find public health data and statistics, information about grants and other funding opportunities. So this is a really cool site. Here. Okay, so now lastly, I'm going to tell you guys about the All of Us research program. Oh, okay, sorry. These are some other important links in Medline Plus and the NLM websites. This is what Iqbal was talking about before. This specifically about evaluating health websites. This will show you how to properly evaluate a health website to see how accurate it is. It tells you the accuracy, authority, bias, currency, coverage. And there are also some other things here, defining health literacy, more things about Medline Plus, the brochure you can share with other people. Okay, so now I'm going to tell you guys about All of Us research program. So I'm going to explain what All of Us is. The program is developed by the National Institutes of Health, the largest biomedical research industry in the world. The main goal of all of us is to advance health research, specifically precision medicine. And this is going to be achieved by creating a health database containing the data of 1 million or more participants. And we need to have such a large number of participants to reflect the diversity of the US and to include participants from groups that have not been traditionally represented, like people from rural populations. So researchers are then going to use this information to learn more about the intersection of biology, lifestyle, and health, which will help them prevent and develop new and better treatments for different diseases. Currently, healthcare is one size fits all. Imagine a future where healthcare is tailored to you, your genes, your family history, your lifestyle, and your environment. This is precision medicine. So take asthma, for example. Asthma affects more than 25 million Americans, but treatments are generally the same for everyone, either an inhaler or albuterol. If you suffer from asthma, your condition is affected by your age, gender, environment, and genetics. Does it make sense to treat 25 million people exactly the same? And it's not just asthma. This applies to many other diseases like cancer and diabetes. Patients are treated with a general one-size-fits-all treatment that may or may not work for them. Precision medicine focuses on treating you as an individual, not your disease. So what can you gain from participating in All of Us? Maybe you know someone or have suffered from diseases like heart disease, breast cancer, diabetes. With your participation, we can learn more about these illnesses and create better treatments. And this directly affects you guys as healthcare workers. Taking part in this program will allow you to take an active role in your own health. You can learn more about yourself, such as the conditions you may be at risk for developing and how your current lifestyle affects your health. And even if you have perfect health, all of us can help those in your family and community who may be suffering from illnesses. And participating in All of Us, you're leaving a legacy. You're directly improving the future of health education and research. Your health information could help us answer questions like, how can we prevent chronic pain, which affects more than 100 million Americans a year? Or how can we develop better pain medications that aren't addictive? All of Us is free to join for anyone living in the US over the age of 18. So people who take part in the program are going to share their health information. The data is then going to go into a secure database, and then researchers all over the world can apply to use this data to study many different health conditions. And then the participants will then get their data back through the health database and can see the results of their contributions through new discoveries. So if you guys decide to join All of Us, you'll be asked to share some different health information over time. You'll be asked basic information like your name, where you live, and about your health and your family. You may be also asked to share your electronic health record if you have one, or be asked to go to a local clinic or drugstore for a free appointment. And at this appointment, your physical measurements would be taken as well as blood and urine samples. So the All of Us research program is unique in that the participant will receive back all of the data they submit. And this is done in a highly secure and private way. All of the information in the health database is anonymous, and there are no personal identifiers attached to any of the information. So this database is going to be really groundbreaking for medicine. And if you guys want to learn more about this or participate yourselves, or if you know anyone who wants to participate, you can sign up through joinallofus.org or just go to allofus.org to learn more. You could also call the number here or download the app. So this is, oh, and honestly, if anyone has any questions, I'll be answering them now. So I'm going to turn off screen sharing. Let me see, stop share. All right. Anyone have any questions?
So any questions? And did anyone hear about All of Us research program before today? Is there anyone hear about this All of Us research program before today?
No.
No? Okay. So as Natasha said, this is a research program that is helping to find out the precision medicine, and this is so important. Now, like kind of treatment is fit for all, one treatment and that fit for all. So we want something that is like individual, so that's why researchers are trying, basically National Library of Medicine is trying to analyze like more than 1 million data from different um, uh, people and community members, so that they can establish precision medicine that will not be fit for all, that will be individual for you only, because everybody lives in a different circumstances, and their socio-economic condition is different, so exposure to the disease also different. So how come like a treatment can be the same? Treatment also should be different individually. That's the idea of the all of us research program, and we should promote the idea. We should help National Library of Medicine to find participate, so that people can be interested to participate in this program. Okay, so last year we did a lot of presentations in the community about different kind of diseases like diabetes, hypertension, arthritis, mental health, balanced diet. So if we get chance this year, we will do presentation on either like all of us research program or Medline Plus, to educate our community, to tell them about what is available for them for free, so that they can be more literate about health literacy. Okay, so you all need to do or complete a evaluation form. Let me share the form with you. Okay. Okay, so somehow it's saying I can't minimize the Zoom call as it's recording. So I will share, I couldn't show you the evaluation form right now, but I will share a form after the call, maybe next Monday or Tuesday. You all need to complete the evaluation form and send that to me. Then you will get the credit. And I know it's already over one hour. So who are still in the call will get like 1.5 hour experiential training credit for joining the call today. Okay, is it sound fair? Our community members are going to the clinic, they are taking the drugs, but they don't know why they are taking the drug. They don't know the side effect. Maybe they are taking a drug for lifelong, but that shouldn't be taken for that long time. So maybe some of the drugs need to take for 3 months, then need to stop. But once they start, they are continuing taking for like 2 or 3 years. It's happening, and we have a responsibility to educate our community, our family members, our relatives, and we will do so. We will continue to do so in the future by the platform of the Health Scholar program. Okay, so I will basically we will arrange several community education program when, like, because of the COVID-19, everything is slow. We can gather a lot of people in a one place. So that's why we still couldn't do an event, but in the near future we will do. So you all as a scholar will go to that community, prepare a presentation as a group, and and educate those people. So maybe I'm not sure when we can arrange this kind of event. Last year we did like maybe more than 20 or 25 presentations in different community, in sales centers, in a food bank, in churches, where people usually gather to educate this underserved and rural community. We did a lot of presentation last 2 or 3 years, but this year is different because of COVID-19. You all know that. So hopefully this situation will be over and we can get a chance to go to the community and educate our community members and serve our community. Okay. So any questions? Any questions? Okay. So thank you all for attending the call today. As I said, I will share the presentation as well as I will share the evaluation form that you need to fill out. So thank you everyone for joining the call. And thank you,
Thank
Natasha, for the great presentation. Thank you.
Thank you.
Thank you. Bye-bye.